My name is Robert Marcus. I'm a consultant haematologist at King's College Hospital with a major interest in lymphoma. The GALLIUM trial was a randomised study between the standard therapy of Rituximab-based therapy plus maintenance Rituximab versus chemotherapy plus a novel antibody called Obinutuzumab, which would also be used in maintenance. When we designed the trial, we wanted to demonstrate a 2-year improvement in progression-free survival, and that necessitated 1,200 patients recruited, which we did worldwide with major recruitment from the UK and from Germany. The trial was stopped by the Independent Data Monitoring Committee, and they told us that the endpoint had been met, and then we presented the data at the American Society and then here as well, and I'm pleased to say the data has also been accepted for publication. The results demonstrated that we did indeed see the projected improvement in progression-free survival with a hazard ratio of 0.71 at the most conservative estimate and a 0.66 at the investigator-led estimate, and that would translate indeed into an improvement in progression-free survival of over 2 years. And that was seen in all the treatment arms, although the trial wasn't designed to assess different treatment regimens. Patients received CVP or CHOP, with the majority of patients receiving Bendamustine. We also saw some unexpected toxicities, mainly in the Bendamustine arm, with an increased grade 3 to 5 toxicity, including some deaths on treatment, which hadn't been expected in Bendamustine. I think there are two ways of interpreting that. Either that's what one sees in a very large trial, doesn't reflect one's own practice, or it may induce people to be a little bit more cautious about Bendamustine usage in patients, especially the elderly or frail. We also saw that the advantages of Obinutuzumab were seen in patients receiving CHOP and CVP, and they may also be treatment options for patients where either Bendamustine is contraindicated or the clinician feels that a different regimen would be appropriate.